the largest migration.
Take the baby, please.
I'm sitting alone over here, got my eyes full of tears, lost my job, no career, so confused that I fear that the world will remember me. I am a refugee, somebody help me please, ease the pain. It's my scream, it's my scream. Somebody help me please, I need this pain to ease. It's my scream, it's my scream. Somebody help me please, I'm on my knees.
Migration is not a new phenomenon, despite its seemingly sudden rise to global attention due to violent conflict. The movement of people, whether within state borders or across international borders, has been occurring for centuries. While migration is not necessarily a risk to health, migration can be a social determinant of health. Being and staying healthy is a fundamental precondition for migrants to work, be productive and contribute to the social and economic development of communities of origin and destination. Moreover, migrants have a right to health, and including them in our health systems is a crucial public health issue. The proposed format of our workshop, entitled Migration and Health, Pawns on the Chessboard of Humanity, includes keynote addresses by the instructors, as well as plenary technical sessions of the thematic areas. You, as participants, will be divided into different working groups, such as government representatives, technical experts from international organizations, primary healthcare physicians, migrants, etc. Case-based study simulations will cover a real-life operational scenario, such as the relocation of a migrant population from an island to another country from the point of view of each working group. Therefore, primary healthcare workers will hatch the medical plan, NGOs will try to ensure the well-being for the migrant population, and so on. Key considerations will include identification of conditions that most affect migrants. Attention should also be given to information collection systems and collaboration between key players managing a migrant crisis. With migration being such a prominent factor in society today, governments are faced with the challenge of integrating the health needs of migrants into national plans, policies and strategies across sectors, responding to the call to leave no one behind. As when from the sea, sailors see the light of a fire that burns high on the mountain in a lonely steading, while against their will the breezers carry them over the fishy sea away from their own folk. So, from Achilles' shield, bright and beautifully engraved, the light streamed to heaven. As Homer describes Achilles' polished shield as being so bright that its reflection resembles the flash of a lighthouse, we, as GPs, have the blessing and the curse to be in the epicenter of migration, advocating for our patients and maintaining the equilibrium of public health. And remember, you may feel like a pawn on the chessboard of humanity, but in the end of the game, you can always turn into a queen. See you all in Edinburgh.
1, 2, 3, 1, 2, 3, drink. 1, 2, 3, 1, 2, 3, drink. 1, 2, 3, 1, 2, 3, drink. Throw 'em back till I lose count. I'm gonna swing from the chandelier, from the chandelier. Young and free.